We've gone from the local to the state to the federal budget discussion this month at our Friday webinars. I'm Tara Britton. I'm the Director of Public Policy and Advocacy at the Center for Community Solutions. Today, I will also be wearing my hat as co-chair of Advocates for Ohio's Future. I'm going to cover a few webinar logistics, do a little bit of introduction before I turn it over to Community Solutions President and Executive Director John Corlett to introduce our panel. So again, thank you all for joining us. I think many of you have been with us since April in our weekly webinars. We really very much appreciate all of you joining us every week to learn about how COVID has impacted virtually everything. And today we're going to talk and focus on the issue of how COVID has impacted the federal budget, conversations happening at the federal level as it relates to COVID relief packages. And we have some experts from the Center on Budget and Policy Priorities to help us understand what's going on there. So very quickly, Advocates for Ohio's Future is a nonpartisan coalition of over 500 organizations in Ohio that promote health and human service budget and policy solutions so that all Ohioans can live better lives. In this seat, you normally see Kelsey Bergfeld, who is the coalition manager, and she's off today. So I'm proud to be the co-chair of AOF. And just very quickly for logistics on the webinar, slides will be available immediately following on our website. We'll put the site in the chat box so you all can access that very easily. We'll also have the recording available later on today or first thing Monday. I know that comes together a little slower in downloading the whole webinar. We also would like for any questions to be submitted through the chat feature. We will keep track of those throughout the webinar and answer those at the end. We want to make sure folks are able to get through their presentations and then get to as many questions as we can. Anything we don't get to, we do try to send out to the speakers afterwards and try to get responses back to anyone who's attended the webinar. So thank you very much. I'm going to turn it over to John to provide a little information about Community Solutions and our speakers. Thank you again.
Thanks, Tara, and thanks everybody for joining us today. My name is John Corlett. I'm the president of the Center for Community Solutions, and you can see here our mission is to improve health, social, and economic conditions through nonpartisan research, policy, analysis, communication, and advocacy. You can see our website there and the policy priorities, the issues that we work on. I'm really happy to be able to introduce our panelists today. If we go to the next slide. And I think if this is your first Zoom of the day or your last Zoom of the day, I think it's going to be your best Zoom of the day. And that's because we love the Center on Budget so much. They are really our go-to source. And with so much going on in Washington, D.C. these days, I mean, changing almost by the minute, we're really lucky to have this team with us today. And so I'm just going to give just a brief introduction of all of them. Sonia is a housing policy analyst with the Center for Budget and Policy Priorities. She previously worked with the National Low Income Housing Coalition, so she's got deep and extensive experience around housing policy. Jesse is a senior policy analyst in the Health Policy Division at the center. And I think Jesse's interesting just because of where his career has taken him. I said he's gone from Cleveland to Alaska to Washington with a little upstate New York and Chicago along the way. And he's really one of our go-to Medicaid guys that we depend on. And then Joseph is a director of research for the food assistance team. I think he's the first person I know who has a PhD in nutrition, so that's kind of exciting to me. And he's also a Center on Budget returnee. One of the things if you work with the center for a long time, people sort of leave and then they come back again to do more great work. So I think Sonia is our first up today, so I will turn it over to her. Or maybe I think it's Jesse actually. I'm sorry.
Great. Thank you so much, John. And really is a pleasure for all of us to be part of this webinar today. The love is reciprocal. We have worked with Center for Community Solutions for a really long time, and we certainly rely on you guys and all of your partners for work in Ohio. As John mentioned, I'm a Clevelander, and I grew up in Cleveland Heights, and once you have that in your blood, you never get rid of it. So I always jump at the opportunity to help out or be a resource for folks in Ohio. So it's really good to be with all of you today. So we have representatives here from the health team, the housing team, the food assistance team. That's not going to cover the whole spectrum of what's going on in DC or what's needed on federal COVID relief, but we're going to do our best to, hit as many bases as possible. So to start off, I'm going to do a brief overview of sort of how we got here, what Congress has and has not done so far on COVID relief. I'm going to talk a little bit about what is happening right now, because there actually is a little happening right now, and how that's going to set us up for the next few weeks and months. And then just given the tragic news on Friday night that Justice Ginsburg has passed away, something that has been sort of in the background this whole time, which is this Supreme Court case that would potentially overturn the Affordable Care Act. It has put that case even more front and center. So it's something that I thought I want to just acknowledge and just talk through sort of what some potential implications are there. So a little bit in review, or, time is sort of lost meaning, I think, for all of us this year. But there have been, depending on how you count them, about 4 pieces of the federal legislation related to COVID that have been passed. There are 2 that we're going to focus on today that were both passed in March. I'm going to, as I go through this, really focus on the health sections because that's what I know. But Joseph and Sonia are probably going to chime in their sections to talk about food assistance and housing. But the first bill, or the second bill that was passed, was actually the Family's First bill in March. And on healthcare, it had a number of provisions in there related to health. I'll flag 2 in particular. The first was that it increased each state's FMAP for their matching rate for their Medicaid program by 6.2 points. So for Ohio, where I think your FMAP is 63%, now the federal government's paying more than 69% of the Medicaid costs for your program. Importantly, that's just for the regular Medicaid program. It's not for expansion. And we did some estimates and projected over 18 months from January 2020 to June 2021. That's going to bring about $2.3 billion of additional federal dollars into Ohio. The other provision that's really important is a maintenance of effort provision. So if a state is going to take this enhanced FMAP, and all states have, they are not allowed to cut people off of coverage. So if you were enrolled in Medicaid in March, you sort of, no matter how your circumstances change, like if your income has increased, you will remain on Medicaid for the remainder. And by the remainder, I mean through the public health emergency. So there's been chatter at some point, because the public health emergency is up to the discretion of the Secretary of HHS. Secretary Azar has extended it a few times. And so for now, it's through December. I think we and many others would argue that the public health emergency is going to last for much longer than that. Then the second big piece of legislation was a few weeks later in March, the CARES Act. That's the one that had the enhanced UI benefit, the $1,200 checks to people. It did a lot to boost the economy, but it wasn't exhaustive, and it actually left a number of important things out, such as increased assistance in increased assistance for the SNAP program. Since then, there's been nothing. We've really, as I said, the CARES Act did a lot of things, but it also didn't do a lot of things. And we would argue that on healthcare, it didn't go far enough in the Family's First bill, that there should be a longer and a larger FMAP for states. And so there's been some competing bills that have come along over that time. So for example, the House passed a huge bill called the HEROES Act in May that would give a spending bill of about $4 trillion. The Senate Republicans, here and there have come forward with proposals. Recently, a few weeks ago, their most recent proposal was voted down in the Senate. So there were times over the summer where it looked like a deal would be close, and now we're in a place where there is no deal. And importantly, a couple of these key provisions have run out. So the CARES Act UI bump only went until the end of July. And we think, the Medicaid FMAP should be extended further and not be tied to the public health emergency. It should be tied to economic indicators like a state's unemployment rate. So there's a lot of things that we expected to get done or that needed to be addressed over the summer that still haven't been addressed. So what is happening in DC? It's busier than usual for this time of year, an election year. Obviously, the Supreme Court vacancy is a big thing, but also they need to fund the government. Funding for the federal government runs out at the end of this month, as in next week. That's actually going to be less dramatic than it sounds. So this week, the House passed a continuing resolution to fund the government to December 11th. It's likely that the Senate will vote on it Tuesday or Wednesday of next week. We don't expect much drama around that. So we expect the government to be funded through December 11th. So where does that leave us around the economy, around COVID, around a federal response? So this leaves us in a place where we have to continue to make the case to policymakers for additional action. And to do that, given all the noise that we're dealing with right now around the election, around just so many other things that are going on in this country, is to just make the case that there is still the need, to make the case that folks around the country are still experiencing great hardship, that states are faced with huge budget shortfalls because of the economic downturn we're in. And just because Congress hasn't acted doesn't mean the problem has gone away. So a few things to just point out how you can demonstrate, or at least how we're demonstrating the need. The first is this increase in Medicaid enrollment across the country. So obviously people are losing their jobs, losing their employer coverage, their incomes are dropping, so more people are becoming eligible for Medicaid. And the increase in Medicaid enrollment started a little bit slow in March and April, but then it has picked up recently. And so you can see this on the slide here. This is some tracking that we've done around states. It's not all 50 states, but for the 35 states that we're able to track through June, and then a smaller number through August, you see that the overall Medicaid enrollment is increasing by about, at this point, up to about 10%. Higher in expansion category. This is probably due to two things. The first is just the recession. Again, people are losing their employer coverage and becoming eligible for Medicaid, but also that MOE provision is making it so people are not dropping off the rolls. So then next slide, please. So then, we really want to demonstrate just that with this increased need for Medicaid, that bump from the Families First bill and the FMAP isn't enough. It should go much higher. So the the HEROES bill that the House passed would have brought the Medicaid FMAP up to 14 points. And then also to retain the maintenance of effort provision. It's also important to tie this to what's going on in state budgets. So we are projecting that across the country, there's about a $555 billion shortfall in state budgets between 2020 and 2022. So, the really important thing to stress here is that FMAP is state fiscal relief. You can help state budgets out in a number of ways. A key way to do that is through increased FMAP to states, because if you're boosting the amount of federal dollars that can pay for a state's Medicaid program, the states have to kick in less of their own money. Next slide, please. And then this slide just shows how critical the maintenance of effort provision is. States often look to Medicaid programs for cuts in budgets when there are budget shortfalls. And so on the right, you can see how states responded during the Great Recession in 2009 to 2012. At the same time, that was another time when Congress passed the bump to the FMAP. There was an MOE there. And so states weren't able to do the eligibility restrictions, but they did cut provider rates. And so without additional FMAP for states, they will likely look to cutting provider rates as a way to trim the cost of their Medicaid program. So I just want to flag that as another reason for additional FMAP for states. Next slide, please. And so this is all coinciding with a couple other just larger factors in the healthcare world, or in the health coverage world. So first is just what's happened to coverage overall in this country over the last few years. And so last week, the Census Bureau came out with its 2019 data. So this is, of course, pre-COVID, but it found that for the fourth straight year, the uninsured rate in this country increased, as did the number of uninsured. And so this drop that you see on the left over time as the Affordable Care Act took effect has actually started to reverse itself starting in 2017. It's due to a number of reasons. The Trump administration undermined the ACA, eligibility restrictions they're putting in Medicaid, like their attempts to do a work requirement in the program, but then also the fear that some of their policies have engendered among immigrants and their families about signing up and enrolling in programs that they're eligible for. Next slide, please. So this brings us to the ACA, which has become the workhorse of the health coverage that we expected it to be in an economic downturn. So, the ACA has expanded coverage by about 20 million people in the country, but it's even more important in times when people are losing their employer coverage and when they're losing when their incomes are dropping. And so one thing I just want to point out is that the ACA is really more popular now than it has ever been before. You can see those two lines sort of crossed each other in about December of 2016. Not coincidentally, it's when President Trump took over that the lines crossed. And so now it's been on positive territory, and it's been there for the last 4 years. And so what these conservative attorneys generals are doing by trying to strike down the entire ACA, and this is supported by the Trump administration, is extremely unpopular. Just want to, just make sure that is clear at the outset that the public has a very strong opinion of the Affordable Care Act. Next slide, please. So really, I could spend 10, 15, 20 minutes talking about all of the horrible implications if the ACA were to be thrown out. Would say just a couple things just to let folks know what's going to happen. Oral arguments are going to be heard in the case on November 10th. So that's a week after the election. And then we would expect a decision to come down in June. So this means a couple things. One, the ACA, you guys have already seen this, is going to be a topic in the election, but then it also means that barring something unforeseen, the decision's not coming till June. So the ACA is here to stay. So for those of you who are enrolling people or helping people enroll in marketplace coverage for next year, you should continue doing that. It will continue, the Medicaid expansion will continue to be there, even, as the arguments happen before the Supreme Court as they deliberate around decision. But just again, so just a couple things that are at stake here. First, well, let me back up. Everything's at stake. We're talking the premium tax credits. We're talking the Medicaid expansion. We're talking the protections for pre-existing conditions, allowing people to stay on their parents' coverage till the age of 25. We'll just point out these two right here. The first, if you take away marketplace coverage and Medicaid expansion, it would undoubtedly reverse some of the gains that have been made in narrowing racial disparities in coverage in this country under the ACA. So these are some Urban Institute projections. The dark blue on the right of each column is the uninsured rate between different groups if the ACA were repealed as compared to today. So for example, for Black people, their uninsured rate right now is about 11%. It would jump up to 20% if the ACA were to go away. Next slide, please. And then this is also just important to point out, repealing the ACA is actually a huge tax cut for rich people. A lot of the ACA was paid for by increasing the Medicare taxes on people with high incomes. You can see that the higher you go up the income scale, the larger the yearly tax cut it would be for people with high incomes. So in summary, just to sort of like, what do we do about this in such a crazy time? A couple things. First, continue to make the case for more COVID relief and really look for examples of hardship in your community and in your state to demonstrate the need. So, this could be through talking about the state budget shortfalls Ohio has, talking about the increased need for Medicaid, people losing their employer coverage, and I'm sure Joseph and Sonia are going to have examples from their world as well. And then just on the Affordable Care Act, to really highlight the importance of the law. You know, for all this talk about pre-existing conditions from Democrats and Republicans, the thing of it is that it's here now. We have it as part of the ACA, and the public doesn't necessarily know that. The public doesn't necessarily equate pre-ex protections with the ACA. So it's important to say, or just to make sure that folks understand that taking away the ACA would take away those protections that we already have. So I will stop there and hand it off to my colleague, Joseph.
Thank you, Jesse. And thank you all for inviting me to join you this afternoon. I was actually on a call with a reporter from the Columbus Dispatch yesterday, so I have Ohio on my mind, even though I don't call it home. So I wanted to build on Jesse's comments by looking at things from a food assistance angle. Food-related hardship has risen rapidly and dramatically during this pandemic. Calls to 211 asking for help getting food were 5 times greater in late March and April versus the period before that. As you all probably have heard in the media, demands for assistance at food banks is up about 40 to 50% compared to normal times, however we define that now. And in just 4 months, the number of people on the Supplemental Nutrition Assistance Program, or SNAP, rose by roughly 6 million. It took about 17 months for that same amount of increase in the last recession. So 4 months versus 17 months. So increase in need for food assistance was rapid and dramatic in this pandemic. All these data point to the fact that there are an alarming number of people struggling to get enough access to food. In early September, with some new data that we just got earlier this week from Census's Household Pulse Survey, about 23 million adults, roughly 1 in 10 adults, is saying that their household didn't have enough to eat in the last week. So just looking back the last week, 1 in 10. You can see on this slide what's been happening, what the data has been showing since June. Unfortunately, there was a break in the series due to a change in the survey that prevents us from having a nice, clean trend from June, from April actually through September. But what we can see is food need is high. Just by comparison, in 2019, when USDA asked this same question, do you have enough food? Adults were saying, about 4% of adults said they had enough, they didn't have enough food in the past year. So 4% saying over the past year they didn't have enough. Now people are saying, 1 in 10 are saying in the past week we didn't have enough to eat. In Ohio, that translates to roughly 850,000 adults saying that their household didn't have enough to eat in the last week. If we go to the next slide. Like many things in this pandemic, people of color are being hard hit. Black and Latino respondents were more than twice as likely to report not getting enough food compared to white respondents. What's particularly alarming is the high rate of food hardship experienced by children during this crisis. Historically, adults try to do everything they can to shield kids from hunger and skipping of meals. But what we estimate based on Pulse data is that about 7 to 11 million children live in households where the kids themselves are not getting enough to eat in the last week. And that's because the household couldn't afford it, so lack of resources. So you think about that, the lower bound of that 7 million, that's, I think, more than the combined population of the Cleveland, Cincinnati, and Columbus metro area. So that's a lot of kids nationwide that are really seeing the impact day to day of lack of food. But as you all know, that's gonna hurt their development, mental, physical development over the years to come. Another point I wanted to make is that the situation has been made worse by the rapid rise in the cost of grocery food. In April, grocery store food prices had their biggest monthly increase in 5 decades. That's dramatic in a time when people are seeing income loss, job loss. Although the price increase has kind of settled down in the last few months, compared to where people were last year, their food dollars are definitely not stretching as far as they did before the pandemic. So as you all know, there's a strong association between food security and health. If people are not getting the nutrition, the food they need, they're not going to be as healthy. Kids who don't get enough to eat may have trouble learning in school, staying focused in school, especially now, staying focused on Zoom meetings if they're distance learning is a tall order. So leading to worse outcomes later on, such as lower likelihood of completing high school and lower earning potential down the line. SNAP and other federal nutrition programs are our best defense against food insecurity. As Jesse mentioned earlier this week, the House passed that CR to fund the government through December, early December. On the nutrition front, the CR extends the Pandemic Electronic Benefit Transfer Program, or PEBT, through next year, through the end of federal fiscal year 2021. PEBT allows families to purchase food to replace the school meals that they miss because they don't have access to school in a remote learning environment. Roughly 3/4 of the nation's 100 largest school districts, with about 8 million students, are starting the school year virtually. And so the loss of access to meals at school makes the renewal of the pandemic EBT program a significant win in the nutrition area. But what about younger kids? What about babies and infants? These younger children don't get anything from the PEBT program, which is focused on school-aged kids. The Family First Coronavirus Response Act that Jesse mentioned bumped all SNAP households to the maximum benefit level for their household size. But for those of you that know how the SNAP benefit is set up, those that are the poorest with the least amount of resources are already at that maximum. So those households, roughly 40% of SNAP households did not see any increase in their SNAP benefits in a time when they really needed it. And we estimate about at least 5 million kids are counted in those households. So thinking about that, connecting eligible kids to the Special Supplemental Nutrition Program for Women, Infants, and Children, or WIC for short, will be vital in the coming months. So in closing, so while the House passed CR is an important step to addressing food hardship, we know that millions of families are still struggling as a result of this pandemic. And we urge Congress to get back to the negotiating table to craft a strong relief package that meets the needs of the millions of families that are still struggling to afford food and meet other basic needs. One key step to addressing food insecurity is to boost SNAP benefits by 15%, which was in the House passed HEROES Act. And that's what we recommend to be part of the next comprehensive stimulus package. So in closing, if you haven't done so already, we encourage you to reach out to your members of Congress to thank them for those who voted in favor of the House continuing resolution. And we ask that you ask them to continue to lift up the needs for a strong relief package for struggling families. So with that, I'll pass it on to Sonia to talk about the housing front.
Thanks, Joseph, and thanks again, everyone, for having us. Really appreciate it. So first, I'm just going to talk a little bit about the hardship that we've been seeing in terms of housing. So I'm sure, as many of you know, the affordable housing crisis isn't anything new. Before the pandemic, almost 11 million low-income households paid over half of their income on rent. That translates to about 23 million people. And HUD's annual homelessness assessment found in 2019 that 500,000 people were homeless on any given night. And 3 times that number spent at least one night at an emergency shelter over the course of a year. The federal resources for housing have been insufficient for some time. Only 1 in 4 eligible families who are eligible for federal housing assistance actually receive that assistance. And looking at recent census data, that came out, this is pre-pandemic census data, we continue to see trends of incomes, of rent increasing at a much higher rate than incomes, and that gap is causing a lot of issues. If you could go to the next slide. So the pandemic has really only exacerbated this hardship. Unemployment rates are really high, and so people are struggling to pay their rent. We've been following the Census Bureau's household pulse survey data, as Joseph mentioned. And he also mentioned that there was kind of a gap in some of the data, and there's been some issues, unfortunately, with the housing portion of that makes it really hard for us to kind of draw some of the same conclusions. One is just a change in the wording of the questions that would make it difficult to kind of draw that continuous line like Joseph highlighted in the food insecurity data. But also there's just a really high non-response rate for the housing portion of that survey, and it's particularly high among survey respondents who with lower education or who are people of color, which those are the folks who are more likely to be behind on their rent anyway. So because of this really high non-response rate, we think that the most recent two weeks worth of pulse survey data are really underestimating the hardship. But we've used that to kind of create our own estimate, and we think about 13 million renters are not caught up on their rent as of right now. And some of the trends that we saw before this shift in the pulse data are still there. So one of them you can see in this graph is that households with children are more likely to not be caught up on their rent. It's 25%, so 1 in 4 families with children, compared to 12% of households without children. And then again, we see that households of color are much more likely not to be caught up on their rent. For Black households, that's about 25%. Asian households also very high at 24%. Latino households at 22%. And that's compared to white households at 12%. And the data for American Indian, Alaskan Native folks is pretty low, so it's hard to pull that out. They get kind of mashed into another category, but we see these dynamics play out over and over again in all these areas, and particularly in housing, given the long history of discrimination. So what has the federal government done? Well, as Jesse and Joseph mentioned, they have passed Congress has passed a few bills. The CARES Act in March provided a good amount of funding for various housing programs. HUD has been slowly getting that funding out there. I think just within the past month or so, they said that they would be allocating funding for the last bit of the Community Development Block Grant, which was about $2 billion. And with that, usually that funding can only be used for about 3 months of emergency rental assistance, but it's now expanded to 6 months, which is helpful. But the funding is still just really insufficient to meet the incredible hardship that families are facing. $2 billion for 13 million renters behind on their rent, not to mention all of the households experiencing homelessness. It's not enough. And some of the CARES Act funding that kind of helped housing authorities or other owners meet some pandemic-related expenses, that funding's running low, so action is definitely needed. Another thing that the federal government did recently is the CDC issued an order that established a national eviction moratorium. I'm sure many of you know about this, and I know Ohio, who's involved in this group, recently did a webinar, and they're just great housing advocates generally. But if you could go to the next slide, actually. I just wanted to make sure to touch on this in case you're working directly with communities. several of our partner organizations, National Housing Law Project, National Low Income Housing Coalition, have put together some really helpful resources to explain the parameters of the CDC order, what it means, how to utilize it. They've also, part of the CDC order is signing a declaration under penalty of perjury. And so one thing that partners have done is translate that document into, it's at 13 languages right now. So that'll be really helpful for reaching immigrant communities and others with it might just be helpful to have it in another language. They also have some good overviews of kind of the legal aspects of it. I know that this order is being implemented in different ways in different places, depending on judges and all of that. So it's something to be aware of and help families kind of navigate this process. It doesn't cover all evictions. It just covers those for non-payment of rent. And of course, it's just kind of a Band-Aid. You know, people will still be accumulating back rent and fees for any late fees, and it will add up. And then when the order expires at the end of December, those folks are at risk of eviction again. So the need for a COVID relief package is really high. So that kind of gets into what should the federal government be doing around housing in particular. So thinking about a COVID relief package, of course, this leads right into eviction prevention, right? We need a significant amount of funding for that short and medium term rental assistance to help people stay in their current homes and pay that back rent that they might have, you know, so that when this eviction and moratorium expires, they're able to just stay in their home. And it's also incredibly helpful for landlords, especially smaller landlords. You know, they might be relying on that rental income for themselves, for maintenance of the properties, and there could be some really harmful long-term impacts if we don't help them as well, because then we might lose some of that precious affordable housing that we have. So in addition to that eviction prevention, we are also advocating for additional housing vouchers. And that would really help provide that long-term housing stability for folks who might need a little more assistance. It would be targeted to individuals who face the greatest risk of eviction or experiencing homelessness to help them stay housed for the long term. So it's less about those folks who maybe missed a month or two of rent and are, you know, maybe working with their landlord. Those folks maybe who are currently staying in a hotel because previously they were in a congregate shelter and now they're in that non-congregate shelter setting, and making sure that they have those long-term resources to stay stably housed, because we definitely don't want to see people who have now been provided some sort of shelter or housing turned out on the streets. So in addition to the vouchers, we want to make sure that the homeless assistance grants are fully funded to help agencies expand that non-congregate shelter, which is really important to preventing the spread of the virus among people experiencing homelessness. They need to be able to revamp facilities, provide protective equipment. And so we're advocating for a good chunk of funding to help that sector as well. And then finally, and this kind of ties into the appropriations piece as well, we need supplemental funding for rental assistance programs to cover increased subsidy costs caused by tenant income losses. So, you know, assisted households, as their incomes change, the amount of rent that they pay changes. And so since a lot of folks are experiencing a decrease in income, they're paying less, which means the housing authorities need to pay more. which means that they need more funding to keep the same number, to keep assisting the same number of families. So if we don't see additional funding for those programs, it would end up being like a cut, and people would lose their vouchers or lose access to public housing, project-based vouchers. And so that is a really big need, and something that wasn't addressed in the continuing resolution that the House passed. So that's a continuing need, and continuing resolutions are always a little tricky for housing programs, because housing programs are so tied to market rates, and every year, you know, rents increase, which means that we need a little more funding to keep the same number of families stably housed. So any kind of long-term CRs are always a bit worrisome. Through December should be okay, except that we have this increased need for all of these housing programs. So we are getting a bit concerned about you know, the timing of this, and how long these programs are going to have to wait, and what it could mean for families. But it all feels like bad news right now. I'm going to try to end on like a little bit of a hopeful note, but I'm not quite there yet. I just wanted to flag a few more things. You know, this administration has put out a lot of harmful proposed and final rules, and I just wanted to flag two that have been finalized recently. So one is rolling back an aspect of the Fair Housing Act known as Affirmatively Furthering Fair Housing, or AFFH, and it calls communities to really proactively look at fair housing issues and address them. And it's really important, especially, you know, I think more and more, especially in the housing field, we're trying to think about equity, and this is a really important tool to push communities to look and see where the inequities are and how they can best address them. And in 2015, the Obama administration put out a final rule that kind of finally tried to implement this aspect of the Fair Housing Act, which was passed in 1968. So it had already been a long time. And almost immediately, the Trump administration started working on rolling it back. And they put out a proposed rule at the beginning of this year. And then recently, at the end of August or beginning of September, they announced that they were just going to go ahead and put forward a final rule without going through the normal process. They didn't respond to the tens of thousands of comments that people had submitted. They just went ahead and put it out there. And you may have heard President Trump talking about this and talking about the suburbs and all of that. And this is what he is referring to. So that's very worrisome, especially thinking about what that may mean for other rules that the Trump administration has proposed and how they might try to fast track them. Another rule on the fair housing front that they recently finalized, actually just yesterday, was about disparate impact. So looking at policies that, you know, aren't intentionally discriminatory, but have a disparate impact on protected populations. And so they issued their final rule yesterday on that. That one did address the tens of thousands of comments submitted, but it's going to be harmful and worrisome. On the slightly more positive note, maybe that's how I'm choosing to look at it. The Trump administration also issued a rule that would roll back protections for transgender and non-binary folks seeking emergency shelters, so people experiencing homelessness seeking emergency shelter, which would be really harmful because those folks are already experience homelessness at much higher rates. But the comment period ended earlier this week, and more than 66,000 people commented. And you know, we haven't done a full analysis, but just looking through all that we saw were opposing this rule. And so, you know, even if that doesn't mean action that we want to see from the Trump administration, I take some heart in knowing that other people out there are paying attention and doing what they can to make sure that people have access to the resources that they need. So that's me trying to add a little bit of hope there, and just encouraging you all to, as Jesse and Joseph had said, continue pushing your congressional delegation on a COVID relief package. You have a really great housing champion in Senator Brown. Senator Portman has also has had some good on housing, but he needs to be continued to push. And so just keeping up the great work. And I think something that could be super helpful is lifting up stories of impacted people in your communities and what the need looks like on the ground in Ohio. Those personal stories are really helpful, and we'll do what we can to lift up any stories too. But that's all from me. Thanks again, everyone.
Thank you, Sonia, and thank you also, Jesse and Joseph. This is Danny Carlson. I'm the Communications Director for the Center for Community Solutions, and I'm going to be asking our panelists some questions that have come in throughout. Again, if you have any questions that you have come up with during the presentation or even now, please feel free to submit them during the chat box, and we will get through as many of those as we can. The first thing, I also wanted to point out the most popular question I can actually answer. The slides and a recording of this webinar will be available. The slides will be available immediately after today's webinar, and then a recording will be available a little bit later today at comsols.com/webinar COVID federal government. That is also in the chat box, so please feel free to check that out. So I'm going to ask questions to each individual panelist, but other panelists, if you have thoughts, always feel free to chime in. So the first one, Jesse, is for you. We had a question: does the new House Democratic COVID relief package that's being discussed include an extension of the public health emergency? And then would that thus extend increased FMAP?
Yeah, so it is up to the secretary to determine when there's a public health emergency and for how long. That's longstanding. And so I focused on the FMAP and the MOE. There's a lot of other stuff that goes along with it. So there's like different Medicaid waiver authority that gets opened up. And the secretary in states has a lot of good flexibility that travels along with a public health emergency. And this, goes back a long time, well before this particular disaster. I guess you could say mistake or short-sighted thing that Congress did was tying the FMAP to the public health emergency. That was a choice. They didn't have to do that. So we, and again, we're facing two emergencies here. There's the public health emergency, and then there's also the economic emergency. And so we think an extension of the FMAP, needs to be bigger, needs to be more than 6.2 points. So that it gives states even more fiscal relief than they're getting right now. And it needs to be longer to really acknowledge that we're in an economic emergency. So even if if we were actually as a country able to make progress on the virus, that would not mean that the economic emergency that we're in would be solved. So we would think that an additional FMAP should be tied to economic indicators. So states would continue to get the FMAP bump, until like their unemployment rate dropped below a certain threshold. So that's sort of the ideal change that we would like to see.
Great, thank you, Jesse. The next question will be for Joseph. And one of the questions that we got for you, Joseph, does the SNAP data address food insecurity among the working poor who do not meet SNAP eligibility guidelines? The increase in benefits by 15% does not appear to consider the need for an adjustment in SNAP eligibility guidelines to include more working poor families with children.
Yeah, that's a good point. No, the HEROES Act did not make any proposed changes to the income limits that would qualify or not qualify a household. So certainly it wouldn't change who is brought in, but in terms of what we've seen in the past, the evidence that we've seen in terms of a boost in the SNAP maximum allotment from the last recession, researchers have shown that at the time, I think it was roughly around 18%. So in the same of the same magnitude that the HEROES Act is proposing, was protective for folks that had access. SNAP participants did not see an increase in very low food security or really extreme hardship to the same degree that comparable families of similar income that were not participating in the program experience. And then as inflation eroded that boost, that bump in SNAP benefits in the last recession, we saw that food insecurity was again rising, was increasing among SNAP participants. So anyway, we're pushing for in terms of being a proven response to the situation that we have now, a boost in the SNAP benefit would increase benefits for all households that qualify. It would get those dollars quickly into the hands of the people that need it, into the local economies that need it, and without much. The PEBT program took a lot of work just logistically, just trying to figure out how to find the kids, how to connect information about these kids, get those benefits out in different mechanisms. The SNAP EBT mechanism, accessing benefits at local retailers is already there. So it's a fast way of getting much needed assistance to families that need it.
And to that point, our director, John Corlett, mentioned in the chat for everyone that Congresswoman Marcia Fudge, we will actually be honoring her for her role in championing the PEBT program and the SNAP program supporting boosting benefits to folks during this pandemic. So you can tune in to that at this time on Friday, October 9th, while we will be honoring her. Sonia, the next question is for you. We've mentioned, and obviously things just keep changing so much these days, but you mentioned that with the eviction moratorium, people are still accumulating back rent. Obviously the hope is there will be more financial assistance. If that expires in December and there isn't assistance, what are you anticipating to see?
Yeah, that's a really scary question to think about, because it would probably be an increase in evictions, potentially homelessness. You know, families do what they can to avoid eviction and avoid being homeless. Maybe they're already behind on rent and they're moving in with another family, doubling up, which of course is not ideal in this situation, given COVID. So yeah, without some kind of financial assistance, it would be really bad. And Eviction Lab, which is at Princeton, has been trying to track evictions, which, you know, are not always the best indicator, because like I said, families sometimes double up, and so it doesn't always result in an eviction. But they did see an increase kind of between the end of expanded unemployment benefits and the beginning of this CDC order. In some cities, they did see like a bit of a increase, even above historical levels. So we know that these eviction moratoriums are helpful, but they're not the end solution.
Thank you. And being mindful of the time, we have one more question we'd like to pose to all of the panelists to chime in. And it's, do you have any additional insight into a new House COVID relief package that's being reported? And we'll start with Jesse and then go down through the line.
I would be fascinated to know if Joseph or Sonia know something, because I've just seen these reports today. So yeah, so this is what I was saying earlier, that sort of like you think it's dead, then it sort of thinks it might have legs, but then it dies again. We're now back in one of these places where it's not dead, but the dynamic here is that there's a lot of moderate Democrats in the House who feel like they need to, 5 weeks before the election, have shown that they're doing something on COVID and economic relief. And they want, the $4 trillion HEROES Act is big. They want to pass something that's smaller, just so they can go to their voters and say, look, we're able to compromise. We came down from this high number. I haven't seen anything out of the Senate saying that they want to pick this up. So to me, and definitely Joseph and Sonia, you guys should correct me if you have a different interpretation. This seems to be about Speaker Pelosi wanting to do something for her caucus. Look, hopefully I'm wrong. Hopefully that there is something happening here. Hopefully she could get something done with the Senate Republicans and with Secretary Mnuchin. But it's pretty sparse reporting so far.
Yeah, I don't have anything else to add to what Jesse. I think with the the wrinkle that we're watching for is the continuing resolution did extend the PBT program. That was great. That was a huge win, but need to continue to go back to the fact that there are millions of kids that are left out of that. We're only talking about school-age kids, so thinking about young kids. The CR also extended some of the flexibilities that state agencies had to administer some of these federal nutrition programs, which are great. But again, what we're trying to make sure is that the kind of celebrating the significant win with the PBT and the CR doesn't lessen the push for comprehensive stimulus bill. But I haven't heard anything about anything specific.
Yeah, I haven't either. I mean, to kind of add to what Jesse was saying, it's very unclear if the House passes a new package, if that will lead to renewed negotiations. But I think it could be an opportunity for advocates, like a good hook, right? And in the continued push to get folks to get back to the negotiating table and pass something that is long overdue.
Great, and thank you to all of our panelists, and thank you for answering those questions. I'm now going to turn things back over to Tara and John to say goodbye, and thank you everyone for coming.
Thanks, Danny. And thank you so much to Jesse and Joseph and Sonia. That was great information, very helpful. Good to close on the note to remind us all to keep at it. I think, there's a lot of stories, important information that we can tell about what's happening in Ohio, and with all of you on the phone who, you serve in the community. That's all really important information to keep sharing with those who represent us in Congress. So I wanted to, again, thank you all for joining us. This is actually I think for right now, we don't know what will happen in the future, but the last of our sort of AOF CCS advocates and community solutions partnered webinars for now. So I wanted to thank you all so much for the information you shared today. Thank you to, I'm sure, folks who have been on our webinars before are on today, so thank you all for joining. Danny posted the link to everything where you can access the recording and the slides in the chat box there, so feel free to do that. Feel free to share it with your networks. We will be taking a break from our weekly webinar next week, but we will be back, as Danny and John mentioned, on October 9th for the first in our Celebration of Human Services series that we have taken virtually this year. It's normally a half day at the end of October in Cleveland, but we are virtual this year. And the first session will be to honor our public service award winners in honor of our former executive director, John Bagala. We are honoring this year, as John mentioned, Congresswoman Marcia Fudge, as well as the director of the Ohio Department of Job and Family Services, Kim Hall, for their work that they've done around food nutrition and access to healthy food. John, any parting words for today? I think that's all I had.
Thanks, Tara, and thanks to our panelists as well. And I really think Sonia's admonition at the end there is something that we should think about. Let's use this opportunity as another hook to engage in conversation with our elected members of Congress. We can't let them off the hook. We've got to keep at this. And so I think that's, if anything, this renewed conversation gives us another opportunity to make that call, send that email, and to reach out to our federal partners. So thank you so much to our friends at the Center on Budget. You're just like a bunch of big brains, there in Washington, and we appreciate that so much. And it's our job to turn all that into action. So thank you all, and have a great weekend.